Each of these areas has a distinct function, okay, and therefore is prone to dysfunction in patients with dementia. I just want to make a point that the term dementia simply describes a symptom complex that a patient has, which includes memory loss plus another cognitive dysfunction, another area of cognitive dysfunction that progresses over time and affects a patient's ability to function normally in either social or occupational circles. However, the dementia is simply that, a symptom complex, okay? What we really need to remember is that dementia is always caused by some underlying disease, okay? Be it Alzheimer's disease, which is the most common cause of dementia, or something called Lewy body dementia, which is the second most common cause in some studies. Multiple strokes can lead to dementia. And then there are less common causes of dementia, things like frontotemporal dementia and others. But dementia is a symptom complex which is always explained by a disease. So when a patient goes to see the doctor for dementia, the doctor's job is to try to figure out what disease is causing the dementia, okay? Whether it be some degenerative disease, some vascular disease, or perhaps even a metabolic or nutritional disorder or caused by medications. There's always some sort of cause that the doctor needs to investigate.
We were sitting at a round table and we were discussing just why we were there, and Mom said to me, "Why are we here?" And I said, "Well, this is Joe's wedding." She said, "Oh, isn't that nice?" And then maybe 20 minutes later or so, "Are we at a birthday party?" I said, "No, Mom, remember, this is Joe's wedding." "Oh." And during the evening we were there, different times she would make reference to why we were there, and I just would keep reminding her. So that set off a bell within my head.
He just believed that if he asked her to go to the kitchen and get something and she didn't return with what he said, that he was angry at her because you can remember, what's the matter with you? You know, he just didn't believe she had a memory loss disease. So he was angry a lot as he was caring for her. So that was tough on Mom. So, and also when he had no conversation with her, which also made him angry. And Mom would just sit on the couch all the time. She got to the point where Mom would not even speak because she was, I felt afraid to say the wrong thing to irritate Dad, the caregiver.
We'd like to talk to you about the proper assessment and how important that is. When you're looking at a diagnosis of dementia, saying that someone has dementia really doesn't tell us a lot, because there's over 60 causes of dementia that we know of today. What we really need to know, is it Alzheimer's? Is it Lewy body? Is it dementia due to a stroke? The diagnosis is most important.
Getting a proper diagnosis is extremely important because by definition, dementia is irreversible. And once you have a diagnosis of a disease that causes dementia, you then have to go on a track of minimizing the results of the dementia and taking the appropriate medication. And of course, like any other disease or disease process, if you go to a doctor who sees a lot of dementia, you're going to get a better, faster diagnosis. Geriatricians are a class of doctors who work with older people. They're very experienced working with dementia. On the other hand, a personal physician may just have mostly young people and never seen dementia before, and you may not get an accurate diagnosis. More and more people are going to neurologists because there are tests, and there, as you had mentioned earlier, you can take pictures of the brain and see whether the brain is getting smaller. Particular areas of the brain are getting smaller.
And someone diagnosed with Alzheimer's can live with that diagnosis from 8 to possibly 20 years.
We're diagnosing more and more drugs.
That's right.
And drug interaction, particularly if you're using any psychotropic drugs, drugs for depression, drugs for reducing anxiety and so on. We seem to be giving a lot of those out, and in fact the amount seems to be doubling every several years. And so all those drugs, the vast majority of them were not developed for dementia or delirium or depression. They were developed for some other neurological application, and the side effect was to make the person less anxious. So there's a lot of interactions that can happen, and unless someone looks at the drug interactions, you're not going to get a good diagnosis. One of the critical things is before you go see a neurologist or even your own physician, make an absolute list of every drug that's taken, even the over-the-counter, Tylenol, anything like that. Make a complete list of what your loved one is taking, because if it is a drug interaction problem, it can be reversed. I'd like to share some information about how you might be able to make your day a little easier, and also the day of your loved one with dementia easier. As we talked about before, dementia is a collection of diseases that can cause losses in short-term memory and long-term memory. But not all memory is affected. The type of memory that doesn't require conscious processing, which I've called automation, which are things that you might call habits, for example, are retained. And actually a person with dementia can learn, because the person with dementia is going through a process in which they get increasingly more confused. They're getting too much sensory information about what's going on around them, and they have not enough conscious processing materials, brain cells, to process what's going on around them. So they're in a constant state of confusion.
The disease is there, and the disease is talking. It's not the person that's talking, it's the disease. The disease is there, and the disease is talking. It's not the person that's talking, it's the disease.
This is a sample of exactly what we've produced in a DVD that will give you more content. Now, the whole idea is to inform and educate and hopefully make this journey a better one for the caregiver, and certainly a better one for the one who's got the dementia. As you can see, without understanding what dementia is all about, and this is the educational process that we're trying to put before the audience that's going through this. And a lot of this is just denying, neglecting the reality of it. I went through it myself. I mean, I denied the word Alzheimer's, and again, I didn't know until I was in the thick of this dreadful disease. And for the last 2 years, my wife couldn't even express herself in words. She was nonverbal. So it becomes a very painful and lonely journey, simply because people leave you, your family leaves you. It's not easy. No one knows how to deal with this. So let's learn by what we can see and share what others have learned along the way. And that's our purpose. And may I suggest that from this little taste of what we're trying to accomplish, and it's all free, what we're trying to accomplish is to make the audience aware, to elevate awareness of this dreadful disease. And the best thing to do is to go to the website, www.cif.us.com. And I appreciate you going there and learning something. Just be patient. It's not easy. But just swallow some of the facts, and hopefully you can turn your anger into compassion. And that's our job. So it's all free. Go enjoy it.